Grain-free dog food was supposed to be the healthiest choice you could make for your dog. Curious. It was marketed as natural, species-appropriate, the kind of food a wolf would eat, and millions of dog owners, genuinely caring, genuinely trying to do right by their animals, switched to it. Then in 2018, the United States Food and Drug Administration opened an investigation, not into one brand, into a potential link between grain-free diets and a serious, potentially fatal heart condition in dogs called dilated cardiomyopathy. Concerned. The pet food industry has not been the same since. Here is the problem. The conversation that followed was either too alarming or too dismissive depending on who was doing the talking. The actual science, what we know, what we do not know, and what is still being investigated, got lost in the noise. Determined. That is what today is about. By the end of this video, you will understand exactly what the FDA investigation found and what it did not find, what dilated cardiomyopathy actually is, and how to recognize it, what the current veterinary guidance says about grain-free diets, and how to make an informed decision about what goes in your dog's bowl, based on evidence, not marketing from either direction. Before we go further, I want to be clear about something. This topic is genuinely contested in the veterinary and nutritional science community. I am not going to pretend there is a clean, settled answer, because there is not one yet. What I will give you is an honest account of what the research shows, where the gaps are, and what mainstream veterinary medicine currently recommends. I am Dr. Amal, 25 years in veterinary medicine. What I share here is educational. It is not a prescription for what to feed your dog. Your dog's specific health history, breed, age, and current condition all factor into nutritional decisions, and those are conversations to have with your own veterinarian. Use today's information to ask better questions, not to make unilateral changes to your dog's diet without professional input. Now, let us get into the actual science. I am Dr. Amal. Over 25 years, I have worked with dogs across every dietary background imaginable: raw-fed, kibble-fed, home-cooked, prescription diets, grain-free, grain-inclusive. I have seen what good nutrition does for an animal over time, and I have seen what poor nutritional choices, even well-intentioned ones, can contribute to. The grain-free debate is one I have followed closely since the FDA investigation began. I have read the studies. I have watched the follow-up research. I have spoken with colleagues in veterinary cardiology and nutrition. What I have concluded is this: the truth is more nuanced than either side of the online argument wants it to be. And nuance is exactly what I am going to give you today. Let us establish what we are actually talking about. Grain-free dog food is food formulated without common cereal grains: wheat, corn, rice, barley, oats. In place of those grains, manufacturers typically use alternative carbohydrate sources, legumes like peas, lentils, and chickpeas, or starchy vegetables like potatoes and sweet potatoes. The market for grain-free pet food grew dramatically through the 2010s. By some industry estimates, grain-free products accounted for nearly a third of all dry dog food sales in the United States by the mid-2010s. The primary marketing message was straightforward. Grains are fillers. Wolves do not eat grains. Therefore, grain-free is more natural and therefore better. There are two problems with that argument. The first is that domestic dogs are not wolves. Dogs diverged from wolves somewhere between 15,000 and 40,000 years ago, depending on which genomic study you read. During that time, living alongside humans, dogs developed the genetic capacity to digest starch significantly more efficiently than wolves. The comparison to wolf nutrition is appealing marketing. It is not accurate biology. The second problem is that grain-free does not mean low carbohydrate. Many grain-free foods substitute legumes and potatoes for grains, and those ingredients are themselves substantial carbohydrate sources. A dog eating a grain-free diet is often consuming as many or more carbohydrates as a dog eating a grain-inclusive diet. The grains are simply replaced with different carbohydrates. That distinction matters. because when the FDA investigation began looking at dilated cardiomyopathy cases in dogs, it was not grains that appeared associated with the condition. It was legumes. And understanding why that might be the case requires understanding what dilated cardiomyopathy actually is, and what taurine has to do with all of it. Dilated cardiomyopathy, DCM, is a disease of the heart muscle. In DCM, the walls of the heart's ventricles become thinner and weaker. The heart enlarges. Its ability to pump blood effectively diminishes. In severe cases, it leads to congestive heart failure. DCM has always existed in dogs. Certain large breeds, Doberman Pinschers, Great Danes, Boxers, Irish Wolfhounds, carry a known genetic predisposition to developing it. In those breeds, DCM is considered a hereditary condition with well-established clinical patterns. What the FDA began noticing in 2018 was different. Cases of DCM were appearing in breeds not typically associated with the condition: golden retrievers, Labrador retrievers, miniature schnauzers, bulldogs. And when investigators looked at what those dogs had in common, a dietary pattern emerged. A significant proportion of the reported cases involved dogs eating grain-free diets high in legumes, peas, and lentils, specifically appearing with notable frequency. The investigation also identified something else. Many of the affected dogs had low blood levels of an amino acid called taurine. Taurine is critical for cardiac muscle function. Dogs can synthesize taurine from other amino acids, methionine and cysteine, in their diet. They are not fully dependent on dietary taurine the way cats are, but research suggests that certain dietary conditions may impair that synthesis. The working hypothesis that emerged, and it is important to be precise here, this remains a hypothesis under ongoing investigation, is that high legume diets may interfere with taurine synthesis or bioavailability through several possible mechanisms. Legumes contain compounds that may bind to amino acid precursors. The fiber content of legume-heavy diets may affect how efficiently those precursors are absorbed, and the overall amino acid profile of some grain-free formulations may not adequately support taurine synthesis in all dogs. In about 2 minutes, I am going to give you the specific signs of DCM that owners can observe, because this condition, like kidney disease, tends to build quietly before it becomes obvious. The FDA investigation, as of its most recent updates, has not established a definitive causal link. The association between grain-free legume-heavy diets and DCM in atypical breeds is real and documented. The precise mechanism remains under investigation. That is the honest state of the science. Dilated cardiomyopathy in dogs progresses through stages. In the early stage, which can last months to years, there are often no outward signs at all. The heart is changing structurally, but the dog appears normal. This is why echocardiography, an ultrasound of the heart, is the only reliable way to detect DCM before symptoms appear. When signs do emerge, here is what they look like. Early and subtle signs: monitor and investigate. Exercise intolerance. Your dog used to walk a familiar route without stopping. Now they slow down or want to turn back before the usual point. They tire noticeably faster than their previous baseline. A dog that was reliably active and is becoming gradually less so without an obvious orthopedic reason deserves a cardiac conversation with your vet. Occasional, unexplained coughing, particularly after lying down or during the night. As the heart enlarges, it can put pressure on the airways. A dog with a new or persistent cough that has no respiratory infection explanation should have their heart listened to carefully. Slightly faster resting respiratory rate. Count your dog's breaths per minute while they are sleeping, not after exercise, not in heat, while genuinely at rest. A normal resting respiratory rate in a dog is between 15 and 30 breaths per minute. Consistently above 30 at rest is worth reporting. This takes 30 seconds and can be done tonight. Occasional weakness or brief episodes of unsteadiness. A dog that seems momentarily wobbly, loses footing briefly, or appears faint for a second or two. These episodes may pass quickly. They should not be dismissed. Signs requiring prompt veterinary attention: labored breathing at rest or an abdomen that appears distended. Fluid accumulation in the chest or abdomen is a sign of congestive heart failure, the advanced consequence of untreated DCM. This is an emergency. Fainting or collapse. A dog that collapses and recovers should be seen the same day. A dog that collapses and does not recover immediately requires emergency care. Blue or gray-tinged gums. This indicates severely inadequate oxygenation. Emergency veterinary care immediately. Catching DCM at the compensated early stage eye before symptoms appear is entirely possible with appropriate cardiac screening. That is where the outcome difference is made. The first mistake is making a nutritional decision based on marketing language rather than ingredient quality. Grain-free is a marketing category. It tells you what is not in the food. It tells you nothing about the overall nutritional adequacy of the diet, the quality of the protein sources, whether the formula meets AAFCO nutritional standards, or whether the manufacturer has conducted feeding trials. Two grain-free foods can have dramatically different nutritional profiles. The label tells you almost nothing useful by itself. The second mistake, and this genuinely surprises most owners, is assuming that natural means safe and tested. The pet food industry is not held to the same pre-market safety and efficacy standards as human food or pharmaceuticals. A pet food company can legally formulate and sell a novel diet without long-term feeding trial data. The grain-free category expanded extraordinarily rapidly on the back of consumer demand and marketing, not clinical nutritional research. The FDA investigation was partly a consequence of that gap. The third mistake is dismissing the DCM concern entirely because the causal link has not been definitively proven. Absence of definitive proof is not the same as evidence of safety. The association is real, the affected dog numbers are documented, and mainstream veterinary cardiology takes the signal seriously enough to recommend dietary review for dogs with DCM of unknown cause. Dismissing it because it has not been fully mechanistically explained is not a scientifically defensible position. Most owners navigating this topic are doing their best with incomplete information. That is understandable, but the quality of the information you act on matters. Here is what you can do, with clarity and without panic. Turn the bag around. Look at the first 5 ingredients. Look for a named animal protein as the first ingredient: chicken, beef, salmon, lamb. Then look at what the carbohydrate base is. If peas, lentils, chickpeas, or potatoes appear in the first 5 ingredients, you have a high legume formulation. That does not automatically make it dangerous, but it is information worth having and discussing with your vet. On the back of any reputable commercial dog food, look for a statement indicating the food meets AAFCO nutritional profiles, and ideally that it has been tested through feeding trials rather than formulated to meet guidelines on paper only. Feeding trials are a meaningful distinction. Not all manufacturers conduct them. Dobermans, Great Danes, Boxers, Irish Wolfhounds, Cocker Spaniels, breeds with known DCM risk should have cardiac evaluation as part of their routine care regardless of diet. If your dog is one of these breeds, ask your veterinarian about echocardiography screening and at what age it should begin. While your dog is sleeping, count the number of complete breaths. 1 inhale and 1 exhale equals 1 breath over 60 seconds. Write it down. Do it 3 nights in a row. If the average is consistently above 30, bring that number to your next vet visit. This is a free, immediate cardiac health data point. Taurine can be measured in whole blood. It is not a standard panel inclusion, but can be requested. This is especially relevant for golden retrievers, which appear overrepresented in the DCM taurine deficiency cases documented in the FDA reports. If you decide to transition your dog off a grain-free diet based on today's conversation, do it gradually over 7 to 10 days, mixing increasing proportions of the new food with decreasing proportions of the old. Abrupt dietary changes cause gastrointestinal distress in most dogs and should always be avoided. And discuss the transition with your veterinarian first. Here is the clear version of what we covered today. Grain-free dog food is not automatically dangerous, and it is not automatically superior nutrition either. The marketing claims that built the grain-free category, that grains are harmful fillers and that wolves do not eat them, are not supported by canine nutritional science. The FDA investigation identified a real and documented association between grain-free high legume diets and dilated cardiomyopathy in dog breeds not typically prone to the condition. The precise mechanism involves taurine metabolism and is still under active investigation. A definitive causal link has not been established. The association is real enough that mainstream veterinary cardiology takes it seriously. The practical guidance from veterinary nutrition specialists is consistent. Prioritize diets from manufacturers with strong nutritional research programs and feeding trial data. Be cautious with diets where legumes dominate the ingredient list. Monitor for cardiac signs, especially exercise intolerance and elevated resting respiratory rate. And if your dog is a high-risk breed or has been on a grain-free diet long-term, have a direct conversation with your veterinarian about cardiac screening and taurine testing. That is the honest state of the science. Nothing more, nothing less. One question before you go. Is your dog currently on a grain-free diet? And if so, how long have they been on it? Leave that in the comments. I want to understand where most owners watching this channel are actually starting from. No judgment, just information. Next week on PawMD, dental disease in dogs. It is the most underestimated health problem in the entire species. Research indicates the majority of dogs over 3 years old have some degree of periodontal disease, and the consequences extend well beyond the mouth in ways that most owners have never been told. That video is going to matter for almost every dog owner watching this channel. Subscribe to PawMD if today gave you something real. Hit the bell. Every week we have this conversation. I am Dr. Amal. Look after your animals. They are counting on you.